I want to share with you 4 things that every one of our practice members should do and be aware of after they have a surgery, especially like a hip replacement or a knee replacement, but it could be any surgery. So 1, the surgery, the anesthesia, the being on the table, knocked out, moving your body around, is going to throw off the brain. No question about it. And we're going to see a need for our brain balance adjustment. We're going to see that in your posture, one side rolled in, one toe out. We're going to see that in the muscle tone on that side. And here's the deal. Even if we were just thinking structurally without thinking the effects on the brain, that's going to throw off your ability to get physical therapy adequately and progress adequately. So as we reset the brain with our brain balance adjustment, that's going to turn on the unconscious muscle tone on that side of the body that went down, and that's going to help your therapy be better. So you're going to progress better with therapy. So it's actually very complementary to physical therapy. So you may need that several times to reboot the brain. Now the other thing is much more subtle, but many people lose cognitive function after a surgery, especially when we're in our 70s and 80s and we have a surgery. We lose cognitive function. And so neurofeedback can really help reboot that, regain that. And again, it's subtle, but you don't want to wait 6 months, a year down the road and realize, oh man, I haven't been the same since that surgery. So get a few sessions of our neurooptimal neurofeedback, which doesn't require an EEG. If there's severe things going on, we'll get an EEG and we'll use that type of neurofeedback with you. But consider that for sure. The next thing to consider is our detoxification foot bath. And I've got a video on the foot bath. It's actually our most popular video on YouTube. But that's going to increase the rate of detoxification, especially out of the tissues of our body, our joints and soft tissues. And that's going to also, in some ways, as we clear those areas, going to help us clear anesthesia better as well. And then there may be certain nutrients that we want to use to help clear anesthesia also. Now, the 4th thing to really pay attention to is subtle infection. And so while the physicians may pick up the overt infections, the really bad infections, and you have to have antibiotics for those, obviously, almost everybody has subtle infection. Like we're going into a hospital for these surgeries. You just can't hardly help avoid it, and the skin is being pierced and you're being opened up and so forth. So you're going to have subtle infection in my experience, and we have nutritional protocols that deal with these bacterial type infections that are very helpful in helping a person rehabilitate faster, help them have better recovery, especially from these joint or hip joint surgeries like knee or hip. So those are the 4 things to think about when you're going to have a surgery. So I want all of our practice members to be aware of that and to take action on that. And if you're not a practice member of ours, hopefully you can find somebody in your area that does a brain balance adjustment, that does a detox foot bath, and that has expertise in clearing subclinical low-grade infections. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.